Okay, hi everyone. Today's topic is the discussion of is autoimmune disease curable? So, this is something that, you know, I think there's a lot of confusion with, and part of it may be because the definition of cure and the concepts of relapse and remission. So, this is, something that if you're suffering from autoimmune disease, you really have to understand. Now, first of all, just before we go anywhere else, if you are suffering from an autoimmune disease, there are many, many things you can do to improve the quality of your life, to change the expression of your autoimmunity, and to really have a huge impact on how autoimmunity can impact your life. So be aware of that. Now, that being said, we have to really define what autoimmune disease is first. There's a spectrum of people that don't even believe autoimmune disease exists. Some people really have unrealistic expectations, I think, with autoimmunity. And these are the things that I really want to discuss. I just want to share with you a little bit about my background as it relates to this topic, because I think this is something that's important to understand. Everyone has their own bias, everyone has their own perspective. So let me just share with you some of mine. First of all, just growing up as a kid and living in a family and having friends and family. I grew up in a family where many people suffered severely from autoimmune diseases, and I can see firsthand what happens to autoimmune diseases. I've had people I know have suicide attempts because of their autoimmune disease. I've seen people end up in wheelchairs, loved ones, because of autoimmune disease. I've seen it completely destroy people's life. So I take autoimmunity really, really seriously. And I think at some point that really influenced where I ended up in life. And where I ended up in life is I saw basically an alternative healthcare practitioner that did nutrition and lifestyle make a huge impact on some of my family members with autoimmunity. And I think that's partially what shifted me in the direction and where I am in my life right now. So outside of that initial influence, I can also say I've seen, without exaggeration, several thousand autoimmune disease patients over the past almost 25 years of working with autoimmune disease patients. And I've seen all types of autoimmune diseases. I've seen the common autoimmune diseases like Hashimoto's and RA. I've seen rare autoimmune diseases where I had a patient once come in a bodysuit because it autoimmune against their skin. I've had patients flying from different countries with their team of doctors to get a workup in my office, and I've worked with teams on managing autoimmunity. So it's not something that I just do on the side. It's something that I have a lot of actual clinical experience working with. And I've been teaching healthcare professionals and teaching postgraduate courses in autoimmunity for almost 25 years also, which means I have to constantly stay on top of the literature and read everything that comes out on it. When you speak at a medical conference, or you speak with the healthcare professionals, you have to be up to date, or you pretty much get destroyed as a speaker. So I really have had that part of it. So I've had real clinical experience. Furthermore, my PhD, my concentration was in immunology and toxicology, specifically in autoimmunity. And my PhD thesis was to identify the mechanism how chemicals can create new proteins and new antigens and then promote neurological autoimmunity. So I've worked as a PhD researcher in autoimmunity. I did my postgraduate at Harvard Medical School for now almost 5 years on topics of neuroimmunology. So I've worked with some of the top researchers in the field. So what I want to share with you about this opinion of autoimmunity isn't just, some random guy that, kind of thinks they know a little bit about it. It's really been a dedication of my entire life for this topic. And I've been at the entire aspect of the clinical aspect, working with a lot of focus, attention, and concentration, developing individualized, personalized programs with autoimmune, and seeing how diet, nutrition, lifestyle can impact that. And I published papers and scientific discoveries in autoimmunity that have never been published before in the scientific literature. And I'm constantly at conferences. So this is an area that is very important for me as an individual. And that being said, there was an emotional chord when we discussed about cure and remission and relapse with autoimmunity that I really want to discuss very openly with you and honestly with you. And I appreciate all the people that follow us on Facebook. And for those of you that do, thank you. And for those that don't, please follow us. We have lots of different talks on these topics that may be useful to you if you're dealing with a chronic disease. But with autoimmunity, you have to understand if you don't have realistic expectations, you will absolutely fall apart. There's a psychoneuroimmune response with autoimmunity. You should absolutely have hope when you're dealing with autoimmunity, but you also need to know what's realistic. So in general, one of the basic statements that I always made in the past is that autoimmune disease is classically not a curable disease, but it's a disease that may feel like a cure for some people if they go in relapse and remission. And then some people really took that the wrong way. So let me explain some things. And people made comments like, "Hey, you're wrong. I've been I found out I had celiac disease, and I have been gluten-free, and my autoimmune disease has calmed away." Yeah, that's called remission. That's not cure, because I guarantee you, if you have celiac disease, if you start eating gluten again, everything is going to flare up. So let's define cure, relapse, and remission first. And also one other thing, there's some people that made some comments like, "Oh, well, autoimmunity doesn't really exist." So let's just start with defining what autoimmunity is. So autoimmunity, by definition, is when a person makes antibodies to their own tissue proteins. It's not really a theory, because you can pull someone's blood, and in their blood, you can see what their levels of antibodies are to their own tissue, like their thyroid gland, or like their myelin basic protein in their brain, or 21-hydroxylase for their adrenal glands. So by basic definition, autoimmunity is when your immune system starts to make antibodies to your own tissue. It's not a theory. It can actually be objectively measured, and that's the basic definition of autoimmunity. So for people that say, well, autoimmune doesn't even really exist, then you're in a different world. And I don't know what that world is, but it's different than the world I know, and everyone in the scientific field and healthcare field knows. Okay, then the second part is like, what's cure and what's relapse and what's remission. So cure by definition means you have a condition. Let's say it's just called a medical condition. You do something, it corrects it, and you don't have to do any more things about it. It's done. So a great example of that would be, let's say, gastric ulcer. So the most common cause of gastric ulcers are people that get infections with a bacteria called H. pylori. So with H. pylori infections, what happens with people is that they start to have exposure to this bacteria. The bacteria furrows into the lining of their stomach, and when that bacteria furrows into the lining of their stomach, it causes inflammation, and it causes an ulcer. And years ago, a guy named Dr. Marshall in Australia discovered that ulcers weren't really caused by stress, but they were caused by this bacterial infection, and no one believed him. And he actually then had to infect himself with H. pylori and take pictures of his stomach with endoscopy and show that stomach was normal, and got the infection with H. pylori. Stomach started to develop an ulcer. Cultured the tissue, found the H. pylori organism in the ulcer, and then treated himself with antibiotics, healed the ulcer, and then took pictures again, and it was cured. And that was a very clear example of that. So there's a mechanism, there's a bacterial infection injuring the tissue. They got rid of the bacterial infection, and the ulcer is cured. And there's no other interventions that need to take place. So that's the definition of cure. You don't have to do anything anymore. Now, there's some things that are not curable. So things that are not curable, for example, if you have your arm cut off, you're not going to have an arm. There's nothing you can do, take pharmaceutically, nutritionally, you have good thought that your limb is actually going to grow back, right? So that's an extreme example of a non-curable condition. Now, in the world of diagnosis, in the world of outcomes, autoimmunity is considered a non-curable condition. Okay, and I'm not to say that miracles can't happen, and there's outliers and things that take place, but in general, in the world of research, in the world of immunology, autoimmunity is incurable. Now, you should also know there are hundreds and thousands of researchers all over the world in major universities dedicated to trying to figure out how to change autoimmunity. And I've met many of these researchers and worked with many of these researchers. These researchers are passionate. They also have family members suffering from autoimmunity. They also themselves suffer from autoimmunity. The reason that some of these world-class researchers are dedicating their whole life to trying to find a way to treat and cure autoimmunity is because they've seen what it does to people's family members and lives and so forth. So no one has discovered a cure for autoimmunity yet, despite the worldwide effort of some very dedicated researchers and scientists. So, and if someone does discover a cure for autoimmunity, they should win the Nobel Prize in medicine. So when I hear people say, as a healthcare professional, a nutritionist, health coach, chiropractor, alternative MD, oh, I cure autoimmunity all the time, I go, well, then you should win the Nobel Prize in medicine, because no one else so far in the entire field of immunology has been able to do that. And then it comes back to, well, what's your definition of cure? And this is where the problem is. So let's talk about what remission is and what relapse is. So cure means you don't have to do anything anymore. It's fixed, like you never had it. So that's cure. Now, in autoimmunity, what we have is a phenomenon called remission and relapse. So remission means the autoimmune disease, the autoimmune expression is dampened. In a sense that, if you think of the dimmer switch, if full-blown autoimmune activity is the lights are totally on, remission means you just turn the lights down, or maybe even turn the lights off. So with most autoimmune diseases, it's possible to have some degree of remission. Some people have greater remissions, and it's not really specific to the autoimmune disease itself. Some autoimmune diseases are very hard to get into remission, but even with some patients that have RA, rheumatoid arthritis, or even relapsing remitting MS, it's easier for them to get into remission or that better degrees of remission than other people from various variables and factors that not everyone totally understands yet. But it is possible to have an autoimmune disease go into remission. And when it goes into remission, if it's significant, the person may feel like they are cured. So it happens all the time with, for example, celiac disease people that go off gluten. It happens all the time with people that have Hashimoto's, and they figure out the right diet lifestyle thing, and all of a sudden their laboratory markers change and they feel a lot better, and the thyroid swelling goes away. It happens with people that have relapse and remitting MS. They lose the ability to walk and feel their face and have numbness, and then they get into remission and they recover and they feel fine. So that's remission. So many times remission gets confused as cure. This happens all the time, especially with healthcare professionals. So when I used to teach all over the country doing postgraduate seminars, I would meet all these different healthcare professionals from all different disciplines that were interested in integrative medicine, natural medicine, lifestyle medicine, functional medicine, and they would attend these conferences. And, usually at every seminar I taught, I'd have one guy come up to me afterwards and go, I cure autoimmune disease all the time. So I don't know what you're talking about. And my simple question to him is well, how do you define you're curing them? And well, the patient feels a lot better. I'm like, well, that's not cure. I mean, that's expected. You could absolutely do things to change that, but that's not cure. And then you go, well, what kind of labs are you doing to see if they're cured? Oh, well, they're for example, their TSH went down or their antibodies went down. That's not cure. That's just remission. That is remission. And that's, I think, one of the areas that's involved. And this included all types of healthcare professionals. It was everything from people that have a lot of training in science and medicine and healthcare to people that have no training. So it was the entire spectrum. There was just this misunderstanding of relapse and remission. So that is what remission is. Remission is that something happens, there's a cluster of changes that take place where the autoimmune doesn't express itself as much. And that is definitely an achievable goal. And that's what we're always trying to do as clinicians when we're having patients trying to change their diet and lifestyle. And even use nutraceuticals, and the combination of all three are important to try to see if they can decrease the expression of their autoimmunity. And if they do a very good job, then they can get into remission and there's less expressions of it. Now, you should also know that there's relapses. Autoimmune disease patients typically have a relapse. Even those that follow the most strict dietary guidelines and change their lifestyle, they will occasionally be a relapse. And when relapses happen, some patients feel like they're back to zero again, and this is devastating. But if patients know that these things happen, they know that they just had a relapse and they need to get through it. So it makes a big change about it. So it makes a big change for their psychology about it. So that's the issue with relapse. So relapses do happen. If you don't know that and you're suffering from autoimmune disease, it's going to be psychologically devastating for you when you have a flare-up, because you think your disease process is now permanent going that way, and it may just really be a relapse that you just need to get through, and then you can go back into being in remission. So I can tell you, working with real-life patients with autoimmune disease and seeing their kids with them in the office that have been devastated by their family members and loved ones with them, and seeing the impact it has as a clinical perspective and also personal experience with family members going through this, I can tell you having understanding of remission and relapse is really important. And there's autoimmune disease patients that feel like they're a failure, that they can't figure it out, that they just don't know what to do with their diet because they're not cured yet, and they're just they feel better but they're not cured yet, and they constantly are feeling negative about it. It is unhealthy. So what I've seen in my years of experience is that patients that don't really understand these mechanisms can have some serious unhealthy psychological impacts from their condition. And if they can understand that there is hope, that there are things you can do, not to take away hope, because hope is really, really important, that you have to know that you're trying to get into remission, and once you get in remission, you're trying to stay in remission as long as possible, and then there could be some relapses, and they're expected, and when it happens, it's okay. Figure out a strategy to deal with the relapse, and then get through it, and then get back into remission. And that becomes the goal, that becomes the strategy, that becomes the mindset. And that is completely different than, oh my God, I'm still not better, everything I'm doing is not working and I feel like a total failure. That's unhealthy. So that's one of the key things with autoimmunity. Now, when you look at when you look at healthcare, and when you look at the spectrum of, when you look at healthcare professionals and people out there of like, hey, what do you think can happen with treatment application for autoimmunity? You have a lot of different things. You have some people that will say there's nothing that can be done with autoimmunity. It's terrible. You have to live with it, and it is what it is. And that's one side of the spectrum. And then you have another side of the spectrum that is like, oh, you can absolutely cure it. All you have to do is just get rid of some heavy metals. All you have to do is just fix a leaky gut, and then it's going to, bam, slip away, and it's going to be cured. I do it all the time. I have lots of patients I've done it to. It's perfect. I'm a magic. I'm a magician. I'm awesome. Both those sides of the spectrum are really unhealthy. And, but those spectrums are out there. And then right in the middle, there's kind of what's more realistic, like everything. The key thing is that, again, you can do things to get into remission, and then occasionally there'll be some relapses. Now, some autoimmune diseases may not have the chance to get into remission. It's just a reality. The definition of progressive multiple sclerosis, it's really hard to get into remission. That's the characteristic of the disease. It's so aggressive. So with that, the goal clinically is just to try to slow it down as much as possible so it's not as aggressive. But it's not the same thing as, let's say, relapsing remitting MS, where there's the chance for remission. So those are the big realities. And when we look at the spectrum of autoimmunity, I think the healthcare professionals that say nothing can be done and there's no evidence, they're wrong. There's absolutely evidence of diet, nutrition, and lifestyle, and sleep and exercise having a huge impact on autoimmunity. And when those people interact with my world, I just say you don't know what you're talking about. You are ignorant of the scientific literature, and you need to go read up on this and stop making these comments, because you really sound uneducated and dumb when it comes to this topic. And then the other side, autoimmune can cure everything. Typically, my response is just tell me what a T cell is. Tell me what really is a autoantibody. Tell me what a regulatory T cell function is. Tell me what labs you run. And usually there's a blank stare, because they have no idea, right? So I think there's a level of lack of education on those ends of the spectrum. So then you have the middle. Now, listen, if you're dealing with autoimmunity, you have to know what's real. And you got to know what kind of things you can do, and you have to also know like where to stay away from. Like, it's not healthy. I mean, if you're working with your physician and they have no training in diet, nutrition, lifestyle, have never read anything about that, you probably should work with someone that has some better knowledge of that. Okay. If you're working with someone who is going to put you on a nutritional protocol and tell you they're going to be cured, or going to put you through 10 sessions of chelation therapy and tell you it's going to cure your autoimmune disease, that is a red flag. You need to stay away from that practitioner. and they're out there. Or if you're going to take some kind of magic supplement cocktail to cure autoimmunity, that does not happen, right? So be aware of those people. So you have to kind of navigate your way through healthcare system. And I don't think that these people that are on these sides of the spectrum that don't think anything that there's nothing you can do for it, and those that think you can cure it overnight with some simple protocols, I don't think their intentions are bad. I just think they're not educated enough in it. They don't have any experience in it. They don't know what they're doing in the context of it. They're still misinterpreting people feeling better as a cure. And those people are probably not the people you want to work with because they don't understand the field. They don't understand the topic. So that's one of the things you have to learn how to do if you have an autoimmune disease, is find the right team and find the right people. Okay, now let's talk about healthy expectations. Now, I want to talk about this from the patient perspective and also from a healthcare perspective, so you know how this works from the other side of the table. So, from the patient perspective, if you're dealing with autoimmunity, if you can get yourself in remission and stay there, you're doing a great job. Okay, that's something you should be really proud of, and you have to put some effort into it. If you're not able to get into remission, you have to look at all the variables that are involved. So, diet, nutrition, lifestyle are all key. When we say lifestyle, maybe you're really in an unhealthy work relationship that you have to change. Maybe you've got to get some physical movement exercise to start to calm down your autoimmunity. Maybe you really have to be 100% gluten-free to really calm down your autoimmunity, or get off other food triggers, or maybe you have to really be strict with an autoimmune paleo diet. Those are things that you really may need to do to get into remission. And if you don't take those seriously enough, you can have some issues. Now, there's also an enormous amount of inaccurate information out there. Like people will say things like, for example, if you have an autoimmune disease, you just need to follow the autoimmune paleo diet for like a few weeks, and then once you feel better, you can start adding food back in. Really? No, that's not how it works. Once you find out what dampens your autoimmunity and gets you a remission, you don't just add stuff back in to cause a trigger. That's really based on the philosophy of like everything is related to leaky gut, and since you remove some foods and fix your barrier, it should come back and you should be healed. You guys, it doesn't work like that ongoing in a realistic clinical scenario. Autoimmunity itself can, for example, continue to break down tight junctions. So there's a level of inaccurate information all over the internet, all over the forums with healthcare professionals, simply because they have an experience of themselves trying one thing and noticing a little bit better, or they read some post with someone doing it, and then they have lack of experience and lack of education on the topic to really understand it. So, as a patient, if you can get to you got to get to the point where you're okay with, listen, remission is a realistic goal, and I want to get there, and I want to stay there as long as possible. And it is okay if I get a relapse. And if I get a relapse, I'm going to deal with it, and I'm going to get through it, and then I'm going to focus getting back on remission, and I'm going to try to see what put me in a relapse, and I'm going to try to avoid that risk factor. You're going to do very well with your autoimmunity, for the most case. There's always exceptions, there's always different scenarios, but for the most case, that we see to be very effective. And then when you're looking at things that cause a person to be in relapse or remission, it's basically things that impact the immune system, triggers. It could be food triggers, it could be chemical triggers, it could be emotional lifestyle triggers, it could be getting proper sleep, it could be lack of exercise. Those are all the things that are there. So those are things that you should know about. We just created a course, by the way, autoimmunity puzzle, autoimmunity solving the puzzle. If you want to learn more about it, go to Dr. K News, and it's a way that I teach people how to go through looking at identifying dietary lifestyle triggers for autoimmunity and how to figure that pathway out. The course is going to be released in May, and it's my attempt to try to get correct information out to people that are suffering from autoimmunity based on evidence-based medicine and actual real clinical experience working with autoimmune disease patients. So, check that out. Now, let's go back to perspectives. Now, I should also tell you, from the healthcare professional, when healthcare professionals work with autoimmunity, it's a very hard thing to work with. Now, autoimmunity, depending how you work with it, but autoimmunity is one of these diseases that's so varied and different from one person to the next that it really, you can't just take a simple medication or simple supplement to have an impact on it. You really need to make sure that you have a very thorough, individualized, personalized evaluation for individual triggers for the autoimmunity. There's no way that you would treat an autoimmune disease case from a dietary nutrition lifestyle model the same, even if the patients had the same autoimmune disease. Every Hashimoto's patients, for example, that would be treated differently. Every patient that has rheumatoid arthritis would have different risk factors and different variables and different triggers. It's what makes the condition complex. And individualized, personalized approaches are very exhausting to work up. They take a lot of time, they take a lot of energy, and this is one of the drawbacks of if you're suffering from an autoimmune disease. If you just walk into a healthcare model where they spend 5 minutes with you and really don't really take a deep dive into dietary lifestyle factors, it's hard to have a strategy. Or if you work with a practitioner and they just are going to give you a gut program to fix everything, it's not really an individualized, personalized approach, so it's not that great. It's not going to have the best impact with you. Now, there are practitioners that do individualized, personalized approaches, and guess what? They're all overbooked. They are all busy. There is a point where healthcare professionals achieve a level of skill and have enough outcomes and enough referrals where they just can't see all the people that would like to see them because they just don't have the time for it. And this happens in autoimmunity all the time. So it's unfortunate, but it's a reality. There's more autoimmune disease patients suffering than there are skilled practitioners to help them. And as a practitioner working with someone who has autoimmunity, one of the first things like we eventually have to learn the hard way is what is the patient's expectations. The patient's expectations, like working with you, is that you're going to cure them. It's automatically something that's going to lead to failure. When from the practitioner's point of view, for those of you that are patients and don't always see it, when you as a practitioner engage in a relationship with the patient, it really is a relationship. There's trust that's built, there's communication that's happening, and they're counting on you to put in time and effort to figure out what's going on. You're counting on them to follow through with things and see if things are working, and it's like really a team effort. And if the goal is cure, it's going to definitely destroy that relationship because it's not realistic. So this is why word remission is much better. It's much healthier for everyone involved. So I can tell you, like in my practice, and by the way, I don't have any. Our waiting list is 3 years out right now, so I'm not pitching any need for new patients right now. But in my practice, what we do is a case review process, and in the case review process, I ask specific questions, and I ask to see what their expectations are. And if it's cure, I immediately absolutely will not work with that patient because I know that relationship is destined to fail. And I can't help them with an individualized, personalized model if that relationship is going to fail because that's where trust breaks down. So that's one thing. Now, another thing is you have some patients that will say, well, I don't really, I'm kind of gluten-free, but not really. But can I just take enough supplements and can that counteract it? And it's like, no, it can't. And, as a practitioner, you sometimes get frustrated because you're going, I have 10 other people that really would take the spot that you're having, and you're just refusing to, for example, just be strict with gluten-free, even though we know you have clearly antibodies that show it's going to trigger your immune response when you eat it, like transglutaminase or whatever, gluten antibodies or something. So that's one part of it. And I can tell you, I myself have wanted to quit practice on multiple occasions, and there's times I have to take breaks from seeing autoimmune disease patients because it's psychologically and emotionally exhausting because it's such a complex condition. I know practitioners who have quit working altogether and have changed careers because chronic disease management is very taxing on them too. So remember, there's an emotional toll on each healthcare practitioner. Each healthcare practitioner that's working with autoimmunity specifically probably had a personal experience with it. Probably had family members suffer from it, and they take it very seriously as well. So they want to do the right thing. A practitioner's sense of self is their ability to help their patient. And if they can't help their patient, their sense of self is destroyed, and then they also have issues with motivation and wanting to do things as well. So it's really important for both the patient and the healthcare professional to have realistic expectations of remission and relapse. So that's the other thing. Now, before we take some questions, just want to just point out a couple of things here. So what is a healthy goal? So what are things you should do as a patient suffering from autoimmunity? Well, I would say, first of all, just look at what's out there in the healthcare system. In the healthcare system, there is truly very little education on autoimmune disease and autoimmune management in general. And if you look at the American Autoimmune Disease Related Association, they found some stats were showing it takes sometimes patients with autoimmune disease 10 years or more to finally get diagnosed, not even treated, diagnosed. And then they've seen, I think it's almost like 24 practitioners before they finally get the diagnosis. And if you look at the world of medicine, just in general, conventional medicine, we don't have an autoimmunologist, right? We have a gastroenterologist, we have a neuroenterologist, we have a nephrologist, we have all these different specialties, but we don't have an autoimmunologist. We have a rheumatologist is, just looking at some joint diseases for the most part, but there isn't an autoimmunologist. The entire field of autoimmunity doesn't have really a specialty in conventional medicine. It's just, you might be an endocrinologist and some diseases are autoimmune, You might be a nephrologist and know that some kidney diseases are autoimmune, and that's kind of it. But we don't have that specialty in conventional medicine. So this is one area that's frustrating. And even when you look at the curriculum, there's not really any training that's significant in conventional training, and also in alternative medicine training of diet, nutrition, lifestyle strategies for autoimmunity. And even if we look at alternative medical specialties, whether it's naturopathic medicine or chiropractic or nutritional counseling or herbalist or oriental medicine or acupuncture, there's a very limited amount of training that's done in a formal setting for someone to get a degree or licensure in that specialty for autoimmunity. So unless you have a diehard clinician that's going to postgraduate conferences and learning everything they can about it and having some real life experience, it's hard to get accurate information. So that's just the healthcare field. And then you have like the internet. And the internet is filled with patients that read something and believe it. It's filled with people that become overnight nutritionists, health coaches that have all these magic protocols all of a sudden. And it's filled with inaccurate information. And, some patients feel like, oh, well, this person, started taking this supplement and they felt better. Why am I not responding that way? Well, part of it is because it's not a realistic model. So those are those things that are also out there. So knowing you have autoimmunity, those are there. So if you can find a good practitioner to work with, and the other key thing, you have to be active. You've got to learn as much as you can about autoimmunity as you can as a patient dealing with it, and figure out what these biases are out in the healthcare system. And then if try to follow people like myself and other experts that can translate research and accurate information for you to help you understand the conditions, your condition, and what can be done with it, and what has been shown in studies to help, and what are some strategies that you can incorporate to benefit you. So those are all the key things. So as far as healthy goals go, first of all, just know the arena you're in, and then secondly, you really want to, I think, accept relapse versus remission, and also think about yourself. Like one of the questions that I ask my patients. Hi.
Hi.
My wonderful wife, as always, Dr. Reyes is here to help me.
Hi.
The other key thing is when you're looking at autoimmunity, you really want to make sure that you're okay with what's out there. Like I was saying, one of the questions I ask my patients is, what would you consider a happy period of time? Like, how would you feel? Like, what would you consider normal? What would you consider an achievement? And sometimes I'll have like a 45-year-old patient with multiple autoimmune disease going, well, I would like to feel like I did when I was 20. And I'm like, even if you didn't have an autoimmune disease, you're not going to feel like you were when you're 20. So that's not realistic. How about, if you have 5 bad days in a week, you end up with only 3 bad days. And how about if you do have a bad day, it's 50% as intense as before. And then you kind of work your way through that. That might be a starting place, and then once you achieve that, you might push for better goals and better outcomes. But those are the key things that are there. So anyways, those are the key things I just wanted to share with you. And before I take questions one more time, I just need to highlight the point. You can absolutely do many, many things to help dampen your autoimmunity. Just because we say it's not curable doesn't mean it's hopeless and there's nothing you can do. Diet, nutrition, lifestyle can have profound life-changing impacts if you have autoimmune autoimmunity, and you should be, if anything, encouraged, because many people with autoimmune diseases effectively go into relapse and go into remission and have a great quality of life, and they just learn how to work with it in a very well, and it's not totally like end of the world doomsday type of scenario. Okay. Anyways, questions.
Hi. Okay, so lots of great questions.
Okay.
Some of them are. This is a very, very common one.
Okay.
Okay, if you can stay in remission.
Yes.
Well, let me say it this way. How do you know if you're in remission? Is it labs? Is it how the patient feels? A lot of people are kind of asking that.
This is a great question.
Right.
How do you know if you're
Thank you, Arlene.
How do you know if you're in remission?
Right.
Yeah, that's a good question. So I could tell you, it's a very general thing. Now, in some diseases like relapse and remitting MS, they have clear definitions of what remission is. That would be like you do an MRI, and then on future MRIs, when they screen you, there's no more scarring, there's no more new lesions, and some of your past lesions have healed. So that's very clear. Now, that's easy to define that with that autoimmune response, because you can do an objective test like an MRI. Now, for other conditions, it's really hard, and there isn't that clear of a definition. For example, you may have rheumatoid arthritis, and there isn't, you could technically look at x-rays and may see no further joint deformity and it's staying consistent. That could be one way. But a lot of times it'll just be the amount of pain you have, right? Or if you have Hashimoto's hypothyroidism, it may be that your TSH levels are stable now. Like, let me give you an example. Let's say a patient has Hashimoto's, and with Hashimoto's, there's an autoimmune response against their thyroid gland, and their thyroid gland gets destroyed. And this is why if you have hypothyroidism caused by Hashimoto's, the typical protocol is to come back once a year to see if you need to have more thyroid replacement. So they'll check the TSH measurement to see if you're needing to take more thyroid hormones, and if it's high, you need to take more thyroid hormones. So let me give you two scenarios. A patient goes in for the next 5 years, and every single year they have to have their TSH levels are out of range, and they have to keep increasing their thyroid hormones to compensate for their amount of thyroid tissue loss. But another patient for 5 years comes in, and they never have to increase their thyroid medication, and their TSH is stable. They haven't had further destruction of the thyroid gland. That second scenario would be an example of remission. So in the context of what is remission, I think you have to kind of look at what the autoimmune disease tissue destruction and expression is, and by definition would be that it's not progressing anymore, because autoimmune disease is progressive. A very simple way to look at it is you're not feeling as bad. Now realize, just because you have autoimmune disease, everything that makes you feel bad isn't always related to your autoimmune disease. Like, you could have an autoimmune disease and be in remission, but you still have blood sugar issues, and you still crash, and you're still tired, and you could still have some inflammatory reactions unrelated to your autoimmune disease, or you can still not sleep well, and even though your autoimmune disease is in remission, you just don't feel well. So it's sometimes difficult to really define what remission is, but the simple way to put it is the disease is not progressing.
Okay. So, great. So then Diane is asking, if you stay in remission, are you less likely to get another autoimmune disease?
Technically, theoretically, yes. So when people have an autoimmune response, we typically check antibodies to multiple tissues. Like, for example, let's say they came in with rheumatoid arthritis, and then we check antibodies to see for multiple tissues. We do a common panel that I use in my office is a panel called Cyrex Array 5, and we see if there's any antibodies to 24 other tissue antibodies as a screen, and sometimes they show antibodies in other tissues. Technically, if you change the immune system to be in remission, you don't really see progression in those other tissues. Sometimes people have a flare-up, and all of a sudden, one autoimmune disease starts to get expressed that they never had before. So they have RA, their joint pain, everything is great. They don't have any swelling. I'll give you an example. Someone has RA, they go on a lectin-free diet, they go on an autoimmune paleo diet, they know lectins like nightshades and seeds and tomatoes and eggplants really hurt their joints. They get off those foods, the joints feel great. They start to get more energy, their inflammation goes down, and they're doing great. But all of a sudden, they had a stressful event, and maybe they got in a car accident, or some kind of physiological trauma happened to them. And then within the next 2 weeks, now they have full-blown hypothyroidism, and their Hashimoto's turned on. And then the joint hurts again. So they had a flare-up. So technically, when you're in remission, you won't have other autoimmune diseases usually get expressed. But the scenarios like I just mentioned, where there's sometimes an occasional relapse, do happen in real life scenarios.
Okay. Elliot is asking, if MS is an autoimmune disease, why is the gold standard to diagnose MRI? Shouldn't it be a blood test?
Right. So with MS, multiple sclerosis it's diagnosed by MRI, and you have to have a certain amount of lesions and scarring on an MRI to clearly diagnose multiple sclerosis. But some people have less than the amount of injuries and scarring to clearly define MS. So even though their MRI shows their brain is injured and inflamed, they won't get diagnosed with MS. They'll just say some type of inflammatory demyelinating disease, and they won't commit to the diagnosis. In the world of medicine and in the world of diagnosis, there has to be clear criteria, because this sets the stage up for insurance coverage, insurance payment, diagnosable communication back and forth with people with certain criteria that has to be there. But in the real world, what studies have shown is that many people have autoantibodies in their blood years before they have changes in MRI. And some people never get enough lesions to fit the criteria of multiple sclerosis, but they still have neurological autoimmunity, and their MRIs still show injury and inflammation. They just get sometimes classified as demyelinating autoimmune disease, or sometimes, since it doesn't fit the definition, they say, well, that's just kind of normal, and it's really not. But those are the realities of what's happening in the healthcare system.
Okay. So what causes autoimmunity? Are certain genes responsible? Are certain people more susceptible? What is the...
So what causes autoimmunity? This is a question that, I think everyone has when they have autoimmune disease. What happens? So first of all, there's a genetic component. And what they found with the genetic components of autoimmunity is they really haven't found, with the exception of celiac, they really haven't found with one gene. Even with celiac, there's a few genes involved with it, but with MS or Addison's disease or Crohn's disease, there are some genes that are involved, but it's really a cluster of genes that are involved. So it's not like if you have this one gene, you're going to get this autoimmune disease, and they could just screen you for that gene. It's not that simple. So there are multiple genes that play a role with each other that can increase risk. So you may have one gene uniqueness that you have that may increase your risk for Crohn's disease by 15%. Then you have another gene that can also add to that risk. And then you have another gene that can add to that risk. And it's really a combination of multiple genes that may impact your risk. And in the world of autoimmune disease research, they do lots of studies with twins. And they can look at the same gene type and see that certain autoimmune diseases get expressed in the environment more than or less based on environmental influences. So most of the twin studies clearly show that environment has a huge role, that it's not just genes. And in the world of immunology, it's basically the perfect storm of a certain gene risk pool in combination with triggers, environmental triggers like chemicals, like infections, dietary proteins, immune system dysregulation, that all kind of cluster together, create the perfect storm, and then a gene will turn on. And a gene may turn on for certain diseases at a certain age. For as an example, gluten sensitivity, celiac disease, and Hashimoto's. Celiac disease and Hashimoto's typically turns on in the third or fourth decade of life. It can turn on sooner or later, but the average is around age 30 or 40 that autoimmune disease turns on. So there's conditions like celiac disease. We know the gene type, and there's studies that show, for example, with certain people, if they get infected with parvovirus, they get infected with parvovirus if they kiss their pets, and the pet has their, a virus, and then it gets infected into them. With certain gene types, that parvovirus could be what turns on the switch for celiac disease. And before that exposure, their genes would have expressed themselves. So it's really a combination of these things. And this is what's very frustrating with find the root cause. I hate the word root cause in autoimmunity, because yes, the root cause may no longer be there. Parvovirus is gone. The autoimmune disease is turned on. So now it's about variables that change the expression of the autoimmune disease. The term root cause means if you find the root cause, you're going to cure it. That's kind of what's inference from it. And this is, again, another unhealthy way to look at this. Now, I understand it's being used and the purpose of it, and I know there's great people that use that term that have done great contributions to helping patients with autoimmunity. But I'm just saying, in general, you have to realize once the genes turn on, the initial triggering event could no longer be there at all. For example, some people have their autoimmune disease turned on because of pregnancy. Like some people with Hashimoto's, and when their ACAG levels get activated and they get into what's called the Th1 state in their third trimester, that combination will turn on Hashimoto's. And then they end up with postpartum thyroiditis and then have Hashimoto's from that point on. Like, what's the root cause there? Their pregnancy? You're going to go back and reverse that? No. So it's a combination of all these factors that are put together. And then once you develop autoimmunity, you lose what's called tolerance. And you start to react to foods and chemicals. And then the more you get exposed to the things your immune system is reacting to, the greater activity your autoimmune disease develops. Okay.
Next question. So Emily is asking, speaking of, do you recommend then against people trying to get pregnant if they have autoimmunity?
Say that again.
Do you then recommend, for someone who's trying to get pregnant, if they have an autoimmunity, do you recommend they don't try to get pregnant then?
No, I mean, again, it's rare for certain people. Like, if you want to kiss your dog, kiss your dog. But certain people will have a gene type where part of a virus can impact
pregnancy.
Right, I understand. And same with pregnancy. Sorry. Like, you shouldn't have pregnancy get in the way of having a normal life and having a healthy life. These things have happened, but they're not in a high degree predictable enough that it's going to happen for everyone that goes through that. Right. Okay. Next question.
Wait. Okay. So Owen, sorry, they're basically asking if are there any early signs? Here it is, sorry. At the earliest stage of autoimmune disease, or even before one develops one, are there certain common symptoms or signs to be mindful of, or something that they can look, you have another test, but you're just like, and then if this certain symptom or sign repeats itself after a certain number of days or months, do you go to the doctor? Like, what would you recommend? So,
that's a good question. Like, what are the earliest signs of autoimmunity? What would be red flags for you if you have autoimmunity? That's a really good question. It's not an easy answer for that because it kind of depends on where the autoimmunity is. If the autoimmunity is in your joints, like an early rheumatoid arthritis, then you may notice in the very early stages, there's certain foods you eat, there's certain things that happen where your joints just hurt all of a sudden. They hurt for a few days, and it goes away. And then maybe you even know what caused it. Another, a few days go by, and then your joints hurt again for a few days, and then it goes by. And then that would be kind of an early stage, for example, like rheumatoid arthritis. So it's going to depend on which tissue is being involved, and each of those symptoms are going to be different. So it's hard to go through every single autoimmune disease and tell you all the early symptoms. But I can tell you as a clinician, what's a red flag for us when we see autoimmunity is the typical scenario and story is a patient comes in, they have a list of very talented practitioners they've worked with and very talented and great doctors they work with. Nothing has helped them. They feel like nothing worked, and they're very frustrated. That's a classical pattern of a patient that may be having autoimmunity that hasn't been diagnosed yet. So I hope that answers the question.
Okay. Yeah, sure. So I just want to make this comment because this makes me laugh. Christopher is saying, you can't help but get a little frustrated with the state of the world's dissemination of ideas. It's a lot of nonsense. And he says, Dr. K is clearly showing his frustration today. It's really good to see. And it's kind of fun. I mean, you have zero tolerance for incompetent people trying to help healthcare practitioners. That's, it's just, that's just there.
Yeah.
And you've seen a lot of these patients, and I've seen you see a lot of these patients, and it's everything you're saying is right on. Good job, hon.
Thank you.
You're welcome. Okay. Oh, so someone is saying Terry Walls, Dr. Walls, she got into remission from MS, right?
Yeah.
She did. Yeah.
Terry Walls is fantastic. Big fan of Terry Walls. I really like her, and I know her. I met her a few times. She has great education if you're dealing with MS, and she has a great person to follow, and she was very effective in getting a remission.
Yeah. Okay. Quick. Tiffany's asking, and other people are asking as well. Is the carnivore diet good for autoimmunity? Is the paleo diet good for autoimmunity? Is that like a bunch of different diets?
I know, right. So this is the difficulty. This is where individualized, personalized medicine comes in. Now, like the carnivore diet is something that's really intriguing for people, like only eating meat. And, for some people, the carnivore diet does work and to some degree. And there's variables we don't understand about it, and there really hasn't been enough research with it. But anecdotally, there are some people that do very well with it. I've had some patients just tell me that's the only thing that kept their autoimmunity under control. Mm-hmm. Now, it kind of is a different model altogether because you're going, well, You have no fibers for your microbiome. Your gut totally changes. But for certain microbiomes and certain ancestral microbiomes, that may have a very powerful immune modulating effect. Now, the most common foods that people react to, we know just based on numbers, is gluten. Gluten is a major trigger, dairy is a major trigger, eggs a major triggers, lectins like and nightshades are major triggers, and this is why autoimmune paleo has become very popular because it does work. Now, before the terms paleo diet and autoimmune paleo were used and carnivore diets were used, when I was practicing, I just see patients, my autoimmune disease patients, come in and they bring in their Tupperware, and they would basically go, "I have to bring my own food because I can't eat out. I can't trust what's out there in the restaurant. It'll really flare me up." And usually they basically ate what was autoimmune paleo, basically some vegetables and some meats and fruits, and that's what they noticed would not trigger their autoimmunity. We're privileged now because we have lots of great authors and books and information that teaches people how to cook and do follow things like an autoimmune paleo. But there's some individual uniqueness with it. If you're really stuck at what what's going to probably have the biggest impact on you if you have autoimmunity, I would say the autoimmune paleo diet would probably have the best impact, where you're actually also off you're off gluten and dairy and grains and nightshades and lectins. That seems to be a key factor. Now, there's specific issues like cross-reactivity, which means certain foods can cross-react even if you're not on an autoimmune paleo diet. So those are all there too.
Okay. Are you done?
Yeah.
Oh, sorry. All right. Can you... Oh, gosh. Sorry. Carol's asking.
Okay.
If she has autoimmunity.
Okay.
What can she do for her children?
Right.
To help, because if it's their genetics and whatever, what can she do to help her children not... I mean, she didn't say, but I'm assuming she means not get autoimmunity.
Not get autoimmunity.
Right?
Yeah, I understand.
I think that's what she means.
So I have a child too. I have a beautiful daughter. And, when you work with autoimmunity and you see how prevalent it is, like the current statistics now, 1 in 12 women will develop an autoimmune disease in their lifespan, and 1 in 20 men will develop an autoimmune disease in their lifespan. And some studies are showing about 10% of the adult population has some autoimmunity, and this is confirmed autoimmunity. It gets pretty scary. So as a father, I'm like, my God, what do I do for my daughter? How do I prevent her from getting autoimmunity? And this is where it really comes to, how motivated you are and what kind of things you want to do. But if you have an autoimmune disease, then at least the gene susceptibility is there, and it's very likely it may be the same autoimmune disease you have. So if you have, for example, thyroid disease or rheumatoid arthritis or lupus, that there's a risk for your children to have the autoimmune disease as well. So really adopting an autoimmune lifestyle is really the key thing. So what does that mean, autoimmune lifestyle? Well, there's definitely things that trigger the immune response. And that all has to do with when you lose tolerance. Now, obviously, I think, getting your chemical load down is really, really important. Sleep, rest, healthy relationships, the things that everyone knows you need to do to stay healthy are really all the same things that prevent autoimmune disease from expressing. Like I said before, one of the things I've realized is now that the world is changing as far as an educator and an author, and is that I can try to put these things in books, but if I can put them on a online program and teach people and walk them through it and show them diagrams and have a video format, I can explain things much better for them. So my attempt to kind of share everything I know how to adopt a healthy autoimmune lifestyle is a program we just finished called Autoimmunity Solving the Puzzle, and this is also why we're having lots of talks on autoimmunity in the next few weeks, and that's going to be launched in May. So if you go to Dr. K News, we have like a registration waiting list, which we always offer discounts to, and that could give you my long hours and hours of discussion of what an autoimmune disease lifestyle is. That can be used for prevention for family members, or it can be used if you're trying to figure out how to get into remission. Okay, next question.
Sorry, some of those making comments about
Okay.
me. I just started laughing. Okay, is ALS an autoimmunity?
So ALS is not an autoimmune disease. ALS is a genetic neurodegenerative disease of motor neurons, and it's a very aggressive and ugly neurological disease. I've had a few ALS patients in my practice. I have had zero success with them. and I don't have any experience in anything to share. If you are looking for some advice, I don't know what to do with it.
Okay. Can you speak about the interventions for stimulating Th1 and Th2, and how do you measure that?
So So Th1 and Th2 are T cells. So there's in the world of autoimmunity, they have these expressions called T helper 1 response, T helper 2 response, and there's actually many more of those. There's Th3 response, Th17 response, Th12 response, Th22 response. But in my thyroid book, I kind of explain one of them, which is like this Th1 or Th2 response. And in a clinical setting, you can measure labs, what are called cytokine stimulated tests, where they take an immune cell and they stimulate it with antigen in the lab, and they see what cytokines get released, and then you can see if there's a tendency for a Th1 shift or Th2. And we know that certain people can either react to some things that stimulate Th1 or Th2, and I talked about in my thyroid book, like things that people that really react either positively or negatively to Th1 stimulators. Th1 stimulators, for example, botanically would be things like echinacea and astragalus. Those types of compounds stimulate T helper cells and natural killer cells, and those levels go up. And for some people have autoimmunity, that really makes them feel better, and for some people it makes them dramatically feel worse. And then Th2 supplements are things like the flavonoids in coffee or green tea or antioxidants. They seem to have an effect on that B cell Th2 side. So sometimes some people say, if I have a sip of coffee, my joint pain autoimmunity gets much, much worse. Mm-hmm. So then we try to have them avoid things that are on the Th2 side. And then if some people on the other side will feel better just saying, if I don't have my cup of coffee, my joint pain hurts all day, or I have to have some green tea every day to feel better. So it can go both ways. If you go to Dr. K News also, we also have articles on these topics that you can also check out.
Okay, so from your research and experience, what autoimmune conditions would you say tend to have a higher rate of relapse, incident rate, which ones are the lowest, or remission, I would say? Is there any way to say that now?
Yeah, because there's so many autoimmune diseases. There's actually over 400 different autoimmune diseases out there. But let's just mention the most common ones. The most common autoimmune disease in the world is Hashimoto's hypothyroidism. And with Hashimoto's hypothyroidism, you can absolutely get into remission. It's pretty straightforward. Graves', which is another autoimmune disease, is a little harder, but people get into remission with Graves' as well. But it's much more. It's more difficult. The second most common autoimmune disease would be things like RA, rheumatoid arthritis. You can definitely get into remission with rheumatoid arthritis. Relapsing, remitting autoimmunity, you can definitely get into remission. Now, conditions that are really hard to get in autoimmune diseases that typically are very hard to get into remission would be progressive multiple sclerosis, which is really why it's defined. It's progressive, meaning the immune system is so aggressive, destroying it, it's very hard to get someone into relapse. Remission. Another very complicated autoimmune disease, for example, is myasthenia gravis. Myasthenia gravis is so severe that in medical management, they sometimes have to take out the thymus to stop the attack. So that's really hard to do much with a tight nutrition lifestyle. But those are the ends of the spectrum, and then there's everything kind of in between.
Okay. What else? Okay, so someone is a little confused. Maybe you can say it again. They're saying it's not just genetics, though, that can cause autoimmunity. There's other things like poor diet, poor lifestyle.
It's not just genetics. Genetics alone don't cause an autoimmune disease. It's genetics with environment.
Okay.
And they use the word genotype for genetics, and then they use the word the phenotype for all the things you get exposed to in your life and how your body responds to the world with food, diet, environment, stress. And autoimmune disease is genotype plus phenotype. And that perfect storm can then turn it on. Once it's turned on, then the person loses immune tolerance, and different variables and factors can trigger it.
Okay, two more. Stephanie's saying, so what are your thoughts about adding an ANA marker to all the basic lab work you do? What do you think about that as far as...
Right. So anti-nuclear antibodies, ANA antibodies, is a common test, and it's actually one of the tests many physicians do as a screen for autoimmunity, but there's a problem with it. Most autoimmune diseases, not most, but many autoimmune diseases don't show up with ANA. So type 1 diabetes, Hashimoto's, very common ones. They don't show up with positive anti-nuclear antibodies. Anti-nuclear antibodies is very specific for certain autoimmune diseases like lupus, different types of like psoriatic arthritis, things like what are called diseases like scleroderma. So it's definitely not going to screen for all types of autoimmune disease, but it can screen for some of the, what they call anti-nuclear types of autoimmune diseases.
Okay, and this just as a last comment, Shane is saying, I agree.
Okay, thank you, Shane.
You know Shane.
Yeah.
Shane.
Yeah, I love Shane. Thanks, Shane.
That's it.
Okay. Any other questions?
No, it's
okay.
one. And
all right, thank you, everyone. Thank you for everyone for joining us today. Please share this video with people, and follow us if you want to stay in touch with all our topics. And if you want to learn more about our Autoimmune Solving the Puzzle program, go to Dr. K News. And I hope this was useful to you, and thank you.